As a family doctor, another very common complaint that we seem to get is a very common yeast infection. A lot of times, a lot of women would come to the practice and complain of having a yeast infection, which is really a very common term, and I perhaps need to spend some time to talk a little bit about this very common yeast infection. Whenever a female has a vaginal discharge, very, very often this discharge is automatically referred to as a yeast infection. And I would say most visits to the family doctor is for this so-called yeast infection. It turns out that very often it may not be a yeast infection per se, because a yeast infection tend to be of a specific nature. And I will spend some time to just try and outline what a common yeast infection is. Usually, if it's a yeast infection, there is a discharge, but the type of discharge is what makes a difference. The discharge tend to be white and somewhat creamy, and is associated with vaginal itching, sometimes on the outside of the vagina, or sometimes even within. And that is a usual classic yeast infection. However, sometimes there is a vaginal discharge and it's just, in a blanket way, referred to as yeast. But when a discharge is more watery, is yellow perhaps in color, and has a malodor or a very bad odor, that is not usually a yeast infection. So you have different types of vaginal discharge, and it would be result from various different other causes, and which would need a totally different approach in terms of treatment. The concern, I suppose, is that to know which infection is sexually transmitted and which is not, or which are the dangerously or the dangerous sexually transmitted infections that most women would perhaps not want to get. Of course, these are things like gonorrhea or trichomonas, or even chlamydia. These infections tend to be not as obvious as the common yeast infection. You tend to have more of a yellow discharge, and you may or may not have an odor associated with those infections. One comment as well, in the case of men, the male who has a yeast, because they can also have a yeast infection as well. But very often what you'd find is that the tip of the penis, or what we call the glans, becomes red with some really small fine bumps tend to appear on them, and you have itching along with it. So when you have that picture, then that is usually yeast. And very commonly, if the female partner has a yeast and has intercourse with the male partner, then that will happen. It can be transferred to the male, although the male doesn't easily get a yeast or develops a yeast infection as easy as the female. But when it appears in the male, it appears as redness to the tip of the penis with some really small, fine red bumps that tend to come up on it as well.